am the chief of the communication branch in CDC's Division of Overdose Prevention, and I'll spend my time today talking about what CDC is doing to stop overdose, which is unfortunately a topic very close to many of us.
The epidemic of drug overdose.
In the United States, drug overdoses take over 250 lives every day and continue to affect communities. So the Centers for Disease Control and Prevention took action. Instead of talking, we listened to people who use drugs, peer recovery specialists, and experts in the field, creating the CDC's campaigns to stop overdose. Focused on 4 distinct topics, each addressing a specific layer of the overdose epidemic. We warned about the potency of illicitly manufactured fentanyl and its prevalence in the drug supply. We spread the word about Naloxone, a life-saving medicine that can reverse an opioid overdose, and encourage people to carry it with them and to keep it at home. We reminded people that mixing drugs can lead to dangerous and unpredictable results, even if they have done it before. And we informed our audience that finding and staying in treatment is critical to forging their path to recovery. And resources to stop overdose deaths and to save lives.
So as you all just heard, through formative research tactics and getting stakeholder input, we identified 4 areas of focus for what would become CDC's Stop Overdose initiatives. And these campaigns are intended to warn people about the dangers of illegal fentanyl, its potency, its prevalence in the drug supply, and ways to protect themselves using things like fentanyl test strips. To explain the risks associated with mixing drugs and the specific effects and consequences of mixing certain types of drugs. To articulate the life-saving power of naloxone, how it works, barriers to obtaining it, what to do if an overdose occurs, and advocating for people to always have it with them. And I hope everybody picked some up yesterday. And to reduce stigma around drug use and addiction, certain treatment modalities like medication for opioid use disorder, and to encourage people to reach out and ask for help. A traditional campaign from the government wasn't going to cut it if we were going to drive change and reach our unique audience of 18 to 34-year-olds who use drugs. So what makes the Stop Overdose campaigns different? Authenticity. These campaigns were vetted and tested with real people actively using drugs or in recovery, ensuring that they were relevant and helpful. Strategic creativity. We refuse to be invisible, to get lost in the wave of content people see every day. We weren't afraid to push beyond what's been done before to appeal to the specific tastes and sensibilities of our audience. Utility, these campaigns are flexible and they create a framework for others to use and deploy in their own efforts. We're working with states and jurisdictions across the country to make sure that they can use this content and apply it in their own jurisdictions and their own unique communities. And we're meeting people where they are. We're disseminating this messaging and content to the places where our audience spends their time, both in real life and online. We're prioritizing sharing factual, life-saving information, promoting harm reduction, and ways for people to keep themselves and others safe, and using a tone of compassion, not condemnation. So marrying creative strategy with insights and data collected during the research phase of developing these campaigns was a key ingredient in formulating success. So I'll share with you some creative from each of the campaigns and talk about certain nuances and features that looked, felt, and sounded different from other types of public health or behavior change campaigns and helped win over our intended audience. Many participants we spoke to weren't aware that fentanyl could be in the drugs they take, be it meth, cocaine, or something else. So we carved out an opportunity by capturing our audience's attention, that telling them that their drugs could contain fentanyl, and hopefully this provoked an important internal dialogue. So here's an example ad execution from our fentanyl campaign, and we ask a big, bold question of our audience. What can be in your drugs? Maybe it's something they've never thought about before. Maybe this would allow them to pause for a moment, reflect, maybe make a different decision. Some of those we spoke to thought that they had a technique or enough experience to know when their drugs weren't just right. So there's a line in the video PSA from this campaign that says, your drugs could contain fentanyl and you wouldn't be able to see it, smell it, or taste it. This campaign is meant to be a clear warning sign to say, there's a potential danger lurking with drug use. So in our Polysubstance Use Campaign, we needed to both acknowledge and correct misinformation and shift certain beliefs our audience held. Beliefs like, I found the right mix that works for me every time. So doing so without being dismissive was really challenging, and we had to get creative. So instead of finger wagging, we contextualized certain decisions with certain outcomes. Again, this was our opportunity to capitalize on the idea that new information can create a new outlook. This was also a great opportunity to speak our audience's language, using words and phrases like upper and downer. Words that were too clinical or scientific would have come off as inauthentic and condescending. This would immediately turn our audience off. And we wanted to visually represent the severity of this issue. So the EKG is a motif you'll see throughout this campaign, and it's striking, it's visceral, it draws you in. The idea that mixing drugs could cost someone their life, specifically those people that our audience loved, was a concern shared amongst all the folks we talked to, and we wanted to strike that chord. One of the big challenges we overcame in developing the Naloxone campaign was making it seem like we were not marketing or selling a product. Our audience feedback during development was critical in getting this balance right. So during this process, we uncovered that there is so much our audience didn't know about naloxone. We've talked about it a lot this week. How to get it, what it looks like, how to use it, how much it costs, and so on. So our creative executions and messaging, we tried to address as many of these questions as possible to empower our audience. And empowerment is a really important theme of this campaign. It was key to show our audience how adoption of these behaviors, always having naloxone readily available and knowing what to do with it if you thought someone is overdosing, added value to their lives and could save the lives of others. Whether that individual uses drugs, they know people who use drugs, someone they love is prescribed high-dose opioids, or they're just helping someone at a party. They had the power and potential to save someone's life. And while naloxone served as the campaign's centerpiece, other methods of reducing harm were featured in our communications. The promotion of Good Samaritan laws, how to recognize signs and symptoms of an overdose, and the specific steps to take if you think someone is overdosing are important tenets of this campaign. So while addressing stigma around drug use, addiction, and treatment is driving this specific campaign, taking an anti-stigmatizing approach was at the heart of developing all the Stop Overdose materials. Using people-first language, avoiding triggering imagery and content that could be offensive or condescending, and underscoring drivers and contributors to drug use were all critical to our success. So two prominent themes of this campaign are that drug use and addiction do not look the same for everyone, and that drug use is a treatable disease. We were trying to instill hope and uplift our audience. So you'll see in this ad execution on the screen, the word recovery is made up of many small paths going in different directions. So this is meant to convey that your path to recovery is your own, it's unique to you, and you should pursue whatever method works best for you. Addiction is a human problem. It's something that affects us all, either directly or indirectly. And it was important that we capture the human element across our communication. So we needed to be thoughtful about how this element was worked into the campaign. Many people we spoke to felt they weren't represented in stock imagery or custom portraiture. People who are addicted to drugs don't have a type, is what we've heard. So these handwritten notes of affirmation in our video PSA that you're watching the production of right now, and the use of expressive hands were some ways that we struck this balance without being stigmatizing or alienating anyone. This approach allowed us to work in a human element without creating a type. So where do we go from here? We're proud of the work we've done so far. We're continuing to build on this momentum. And so we're doing some additional formative research and collaborative efforts within CDC, and we're working on products and materials for various other audiences, like first responders, youth, African Americans, rural audiences. Health equity is centered in everything that we do, and we understand that there are needs across these various audiences. So we're also about to launch a qualitative and quantitative study with our Spanish-speaking or Spanish-reliant audience so that we can test some of our trans-created stop overdose materials for this specific audience to make sure that they resonate with them and that we provide cultural competence and coherence. We're actively developing content to expand upon these campaigns with an emphasis for now in the areas of harm reduction and stigma reduction. These opportunities will help bring attention to and promote effective ways for people to keep themselves safe. So we hope to create a better understanding about what stigma is, the broader impact of stigma on our society, and how to talk about stigma with others. And lastly, we're launching a program evaluation this year to really gain insight and perspective about the campaigns. This will aid us in refining and evolving the campaigns as we move into the coming years. We hope to share some data with that from that evaluation with you in the coming years. And with that, I would really like to thank you for your time and attention this afternoon. This is a topic that's very close to my heart and is very important to many of us. I'd especially like to thank my colleague, Brittany Curtis, who's in the audience. She facilitated a breakout session on these campaigns yesterday, and much of the work that you've seen is due to her hard work and creativity. And I also want to thank our partners at Brunette Garcia Advertising and ICF Next. So stop by our Stop Overdose website, use these materials in your communities and your campaigns, and thank you for your support in helping to stop overdose in your communities.